I request Prajakta Madam to start the today's session with introductory part.
Good evening, all. Dr. Mamde sir has done M.V.Sc and Ph.D. in the field of veterinary anatomy. Currently, he is working as professor and head. He has more than 20 years experience in teaching field. Dr. Mamde sir had major contribution for the development and building various plastinated specimens. He actively involved in departmental activities. With this, I request to Dr. Mamre sir to start today's topic. Thank you.
Okay, thank you, madam. Good evening. Myself, Dr. Mamde, professor from Department of Veterinary Anatomy, College of Veterinary and Animal Sciences, Parbhani. I have been asked to deliver a topic that is anatomical awareness with its applicability in field. I am very much happy to tell you that anatomical awareness means anatomical knowledge. You must be aware of basic anatomical knowledge that will be applicable in field. In field, that may be for surgeon or maybe for clinician, for surgeon or physician or scientist or field heads or in general veterinary practitioners. For all these veterinarians or field people, this basic anatomical knowledge is very essential, and that knowledge they have to apply in field. This is in brief about my topic. Next, about veterinary anatomy. What is anatomy actually? Anatomy is the study of simple body structures. Simple. Study of body structures or study of form and structures, that is anatomy. If study of functional aspects of these structures are concerned, that is physiology. But here we are concerned with general body structures or structures of various body parts. Again, when structures are concerned, these are studied by two ways. One, gross anatomy, means the structures or body organs, they are studied with the help of naked eye, or with naked eye, whatever visible that we are describing or these features we are studying, that is actually gross anatomy. And another aspect, that is microscopic anatomy, in which these structures or body parts we have to study with the help of microscope. These two basic aspects. Again, as far as gross anatomy or microscopic anatomy is concerned, again we are studying in different animal groups. Routinely we are studying in livestock. Livestock means animals which are reared by human beings for their benefits. Another, lab animals are also there, where experiments these are conducted. And another important, that is wildlife. Nowadays this is having very importance because nobody is thorough in anatomical knowledge of wildlife organs. Again, as far as livestock is concerned, routinely we are studying in this anatomical study in rearing animals, that is ox, horse, dog, sheep, goat, pig, poultry, even poultry, that is bird, and rabbit, that is lab animal. Lab animals routinely used for experimental purpose, that is rat, mice, guinea pig, rabbit, etc. And wildlife, still it is this part. Whenever wildlife body or wildlife animal comes for postmortem, lot of veterinarians, they are having problems because they are not knowing normal anatomical features of various organs of that particular wildlife. That's why this part is still having great importance as far as coming days are concerned, because during postmortem, yes, any problem? During postmortem, these field veterinarians, they are come across number of problems. Sometimes some wildlife organ they are collecting or they are getting, and in veterological cases there is a problem of identification of species. At that time, you must have basic knowledge of anatomy of that particular wildlife. At least we must have basic knowledge of whatever commonly occurring wildlife is there in India. At least that much knowledge you must have. Then another thing, again, one thing I want to clear here, whatever species are there, livestock species or lab animal species or wildlife species are concerned, each and every organ of the body is differentiated on gross anatomical ground from another species. This is basic C. Number of systems are there, number of organs are there, and each organ is differentiated from another species with same organ of that another species on the basis of gross anatomical feature. This is one thing. Means, see how much difficult to study this whole animals or all type of animals, livestock, lab animals, wildlife. This somewhat difficult. Then another important thing, microscopically also each and every organ differentiated from another species, same organ, suppose stomach of ox compared with stomach of dog and stomach of horse. Histologically these three are different. In case of stomach of ox, was earlier three compartments are non-glandular, fourth compartment is glandular. In case of equine, earlier some portion which is towards esophagus is non-glandular, remaining portion which is towards intestine, that is glandular. In case of dog, total stomach is glandular. Means histological grounds also we will differentiate one organ from another or same organ of other species. Means species wise differentiation is possible on histological ground also. This is in brief about introductory part. Then still this anatomical awareness. What is this anatomical awareness? Means you must have basic general knowledge related with anatomy, that is which is essential in the respect of site. You must have exact site from which, again this is very important for physician and surgeon. Whenever surgeon performs operation, they are considering site of operation, because through that site, whatever organs they are operating, to which organ they are operating, with minimum distance, because there is a rule in surgery, with minimum distance we have to approach up to that organ. When you are approaching with minimum distance, less bleeding will be there and recovery will be fast. That is the importance. Then another structures of the various body organs. Again, body organs, they are having various structures. That may be organ of digestive system, respiratory, urinary, whatever it may be. Then organs, they are having blood supply, nerve supply. Then organs, they are divided into different body regions. Again, body regions, they are in general head region, neck, thorax, abdomen, pelvis, tail, forelimb, hind limb, like this. And these body regions and their contents, thoracic region or thoracic cavity, contents of thoracic cavity. You must have a brief idea about how low organs, that is lungs or heart, esophagus, trachea, how they are placed in that cavity. Similarly, in case of abdomen, this is in general. Means you must have basic knowledge of anatomical body regions and their contents. Then body systems and basic functions. Means digestive system, organs of digestive system in serial order, organs of respiratory system, urinary, male, female. Again, digestive system, major role concerned with digestion of food particles. Again, organs, they are from mouth cavity up to anus. Respiratory system concerned with respiratory exchange in lung. Again, starts with nostril, nasal cavity, pharynx, larynx, trachea, bronchi, and lungs. And lungs, that is the actual organ of respiration where exchange of gases takes place through alveoli and blood. Then urinary system, where waste product, these are removed from blood. Then male genital system concerned with production of male germ cell, that is sperm, and in case of female, that is ovum, that is female germ cell from ovary of the female. Like this is in brief. You must have at least some brief knowledge about these anatomical structures, or you must be aware of all these anatomical structures. Then field applicability. Now you are having some basic idea about anatomical knowledge. Now this basic knowledge you have to apply in field. During application, what happens? It is for diagnosis purpose. Again, for diagnosis means, again, whenever your diagnosis, or a simple example I am telling you, whenever patient comes in hospital or whenever sick animal comes in hospital, there is a method of examination that is called as method of clinical examination, in which we are following it certain particular steps. In which first step, that is inspection, observation of that animal from a short distance so as to point out abnormalities in that animal. Means during inspection, whether animal is walking properly, whether any fecal matter is there at the posterior aspect or around anus, or is there swelling in that paralumbar fossa region or flank region. All these things we have to observe from a short distance so as to detect abnormalities. Then another, that is auscultation. Auscultation with the help of stethoscope, listen sounds produced by certain vital organs, particularly heart, lung, and sometimes rumen. Then percussion with fingertips. We have to strike that body part, and you will listen certain type of sound, and on the basis of that sound, you will diagnose certain things. Then observation of mucous membrane of eye, that is generally observed for if there is a congestion, that is redness, pale, then that indicates dehydration. If yellowish, that indicates jaundice, etc. All these things are observed, or all these things are diagnosed by observing mucous membrane. Then biopsy, that is the sample collection from live animals for examination purpose, particularly skin, etc. For parasitic examination is collected, and later on we have to diagnose type of disease or disease condition is there, that we have to diagnose, and treatment will be followed. Then fluid collection, different fluids, blood, etc. we are collecting for examination purpose. Again here particularly this CSF, cerebrospinal fluid, is also collected for examination purpose. Then radiography for observing fracture or fracture like cases. Then ultrasonography, particularly for pregnancy conditions or confirmation of pregnancy, ultrasonography is performed, or for a lot of things. Then this is basic concerned with diagnosis. Then another treatment aspect is there, either physician or surgeon. Physician generally uses various types of injections, where we have to introduce these injections, types of injections, that is intramuscular, intravenous, subcutaneous, intramammary, like different types of injections are there, and their sites. You must have basic knowledge of sites where we have to introduce these injectables. Then surgical operations, whenever we are performing any surgery, again you have basic knowledge of, suppose we are performing rheumatology, esophagectomy, cesarean operation, or diaphragmatic hernia. For all these things you must have basic knowledge. Means as far as treatment aspect is concerned, we are generally using injections by physicians or surgeons, or surgical operations. Then third, that is selection. Means for judging of animals, whether that particularly in case of cows, on the basis of certain structures, we will judge whether that animal is giving more milk or not. All these things are judged by just of observing that body from external aspect. This is field applicability, means basic knowledge and field application. Here combined study or combined type of topic which is related with field veterinarians. That's why I have selected this topic. The next, in general, organization of body. How body is organized. Whenever I am asking question to my students, they are what are components of the body, what are constituents of the body. They are telling, sir, body is made up of muscles, sir, body is made up of bones, body is made up of organs. Now, whenever we are thinking all these things, basically, body is comprised of body systems. Near about 10 body systems are there, and these 10 body systems, they are comprised of various organs. Now, each organ comprised of different types of tissues, minimum 2 or more than 2 tissues. Group combinedly they are forming organ, and tissue is the group of cell. Means basically body is comprised of number of cells. This is one thing. And apart from cells, fluids, that may be blood, lymph, etc., or secretions, all these things. Means in short, body is considered as made up of cells and fluids only. These are two basic components. Means cells, again for different types of cell groups, they are unites to means similar type of cells performing unites to form a similar unites, and they are performing a particular type of function, that is a tissue. Again 4 different types of tissues are there. 4 tissues involved in the formation of organ, sometimes 2 tissues, 3 tissues, and number of organs in serial order. They are forming body system like digestive, respiratory, urinary, male, circulatory, lymphatic, all these things. And number of body systems, they are present in whole body. This is in general organization of animal body. Next, whatever body systems are there, just I will enlisted here. Simple integumentary system, that is concerned with skin. Again, skin is the largest organ in the body. Lot of research is going on as far as our Parbhani Veterinary College is concerned. On skin we are doing research. Major species we have finished, and still one or two students, they are working on skin of pig and sheep. Then skeletal system. Skeletal means muscular system. Skeletal muscles. Sorry, skeletal means skeletal. That is bones, joints, and components of joints. That system is considered as skeletal. Skeleton, framework of bone. Means bones, they are joined with each other by means of joints, and joints, they are having ligaments, etc. Combinedly, this is skeletal system. Skeleton. Then muscular, over the skeleton, means muscular means particularly here skeletal muscles. Means muscles which are covering this skeleton. These are actually voluntary muscles acting as per willpower power and responsible for movement of individual. Then nervous system concerned with brain, spinal cord, as you are aware about nervous system. Then endocrine glands, pituitary, then pineal, this adrenal, such type of glands. These are endocrine ductless glands which pours their secretion directly into blood. Then circulatory system, heart and its vessels, that may be arteries or veins. Lymphatics means lymphatic, that is lymph vessels, lymphatic glands. Again, primary lymphatic organs and secondary lymphatic organs. Primary, that is thymus and bone marrow. Secondary lymphatic organ, that is spleen and lymph nodes. And all these is brief. What is lymph actually? Nowadays, this lymphatic system or immunity concern is very important, having importance. What is this lymph actually? I am brief telling you. What is this lymph actually? Because nowadays this is having importance. There is immunity बढ़ाओ, ये बढ़ाओ. So this के लिए, what is this lymph actually? Lymph is the tissue fluid. What happens in general? Blood supply to each and every organ and structure is there. Now from larger, suppose a four-limb blood supply is there, brachial artery, it gives radial, medial, ulnar, and the digital arteries. Now these arteries, they are entering into that muscular tissue. Then they are forming arterioles, another branching. Aorta, artery, smaller artery, arteriole, and then arterioles, they are branching into capillaries. Means capillaries, they are actually penetrating into that tissue. This is arterial end. Means whatever blood is entering in that tissue, supplied to that tissue, major blood is returned from venous end. Means nearby arterial capillaries, venous capillaries, these are located. They are collecting major blood. But some of the fluid, some of the blood is entering into the surrounding tissue, and that is called as tissue fluid. That is actually lymph. And then venous return is there, means major blood return via again venous capillaries, venule, vein, vena cava, and directly that is posterior vena cava, which opens into heart. This is in general a circle. Means here tissue fluid which is gathered in between tissue, that is collected by a separate system, that is actually lymphatic system, and again that enter into bloodstream in the posterior vena cava. Now this lymph, before entering into bloodstream, gets circulated, or it must be passing through minimum one or two lymph nodes, and then it enters into bloodstream. And this is having immunity, because whenever it is passing through lymphatic organ, these lymphocytes, they are added into that blood or into that fluid, and they cleanse the blood lastly. This is in brief about lymphatic system. Now respiratory system again starts with nostril, nasal cavity, pharynx, larynx, trachea, bronchi, and lungs. As I already mentioned, concerned with respiration, exchange of gases, oxygen is taken, carbon dioxide is removed, and this unit, that is blood alveolar unit, is located in lung. Then digestive system, again I already mentioned organs, urogenital, urinary, male and female. This is in brief about body system. Means you must have knowledge of brief account of these 10 body systems, because every animal body ho ya phir human body having 10 body systems. Then next, see, these are anatomical planes. How these are sections, these are taken. This is longitudinal plane. From central midline section is taken. Then sagittal, parasagittal, transverse. Again, transverse plane, which divides animal body into head region and tail region. Again, that is another plane, that is uh, these are different planes: median plane, sagittal, paramedian, longitudinal, transverse. These are different planes of the body, which are these planes. These are for historical purpose. Generally, we are taking sections. At that time, these terms are useful. Again, routinely used common anatomical terms. See, routinely we are using these common terms, that is anterior, posterior. Anterior, front. Posterior means towards head. Posterior towards tail. Superior towards upper side. Inferior towards lower side. Cranial again towards head region, head part. Caudal towards tail part. Medial, lateral. Inner side, lateral, outer side. As far as limbs are concerned, lateral side, medial side. Proximal, distal. Proximal means end which is towards body, and end which is towards away from the body, that is distal. Particularly these types of terms, these are used in case of bones. Unilateral, bilateral. If structure they are located, again simple example I am telling you, unilateral paralysis means one side paralysis. Bilateral paralysis, both side paralysis. Then superficial, intermediate, deep. Superficially located, then next, and deeper, located in deeper parts. This is in general about body planes. About sagittal, paramedian, frontal plane. That is actually frontal plane which divides animal body into head part and limb part. That section which is perpendicular to the longitudinal, that is frontal. This is about planes. Then movements in the limbs, that is flexion, extension. Whenever angle between two bones, that is reduced, that is flexion. Angle between two bones when it is increased, that is extension. Adduction, abduction, inner movement of the limb, or towards center, movement of limb towards center, that is adduction. Movement of limb away from the center, that is abduction. Circumduction, making movement which makes circle. These are this is about branches of anatomy. Just a minute. Now, as far as branches of anatomy is concerned, that is veterinary anatomy. That is branch of anatomy which deals with the structures of the animal body. Topographic anatomy, that is the branch of anatomy which concerned with the structures present in particular topography or particular region. It is also called as regional anatomy. Comparative anatomy, whenever we are comparing one organ with other, with different species, and that comparison is done, that type of study is actually that type of branch is comparative anatomy. Surgical anatomy means branch which is concerned with surgery or operation, means what type of structures you are cutting during that particular operation, that is surgical anatomy. Spatial anatomy concerned with particular species, study of the system of equine, canine, porcine, that is particular species, that is spatial system anatomy. Then applied and branch of anatomy, in which you have to apply basic knowledge of anatomy and apply that knowledge with field conditions. Then functional anatomy means study of organ along with its function. Systemic anatomy, branch of anatomy concerned with particular system, digestive, respiratory. And another last, this surface anatomy. This I will tell you about the surface anatomy. Just a minute. Now the surface anatomy, see, this is very important, because for physician or surgeon, they are observing just body structure externally, and by observing body structure externally, they are performing surgery or they are introducing injections, all these things. Simple surface anatomy is the branch of anatomy which deals with the form and surface markings present on the body of animal. Or certain landmarks are there on the surface of the body which are helpful for approaching interior organs present inside the body. It is also useful in locating and identifying anatomic structure prior to studying internal gross anatomy. Then it helps in diagnosis of clinical cases and makes easier for treatment. Field veterinarians can relate external surface markings to the location of internal organs. It is also called as superficial anatomy or visual anatomy. Superficial, which is clearly visible from external side, or which is visible from your naked eye by observing external body or external surface of the body, we see certain landmarks or forms and surface markings present of the body, and these markings or landmarks we are using for operative purpose, for other treatment purpose. This is all about this surface anatomy. Then it can be best studied by using regional approach. Again, surface anatomy, again, it is routine nowadays. Our syllabus is changed. We are studying all these topics region wise. Head region, head region, neck region, thorax, abdomen, like that. This is all about surface anatomy. Means from surface view, we have to approach up to animal for treatment. Then animal body is divided into various body regions. Now these are 8 body regions. Now here I will tell you different body regions, contents and applied anatomical aspects of these body regions. Now body is divided into 8 body regions: head, neck, thorax, abdomen, spelling is wrong here, sorry, then pelvis, tail, forelimb and hind limbs. Now here this is in general external surface of the body and showing different body parts. Head, this is head, neck, thorax, abdomen, then this pelvis, forelimb, hind limb, like this. And then this is tail. These are body regions. Now here, first that is head. Now head is having, now see, these are basic anatomical structures having applied importance. Head is having some of the features I have, these silent features I have taken, or silent structures which are having applied importance, that I have taken here. Forehead, muzzle, mouth, lips, nostril, eyes, ear, horn, teeth and sides for nerve blast. Near about 10. Now these are 10 applied anatomical aspects one by one. See, this is head region, these are horns, etc. Now I will tell you about horn. Generally these horns, these are hard structures originating from the each side of forehead region, and on the basal part of this horn there are certain thickenings or rings are there of thick or thin, lesser or greater thickness. On the basis of these thickness of these rings, one can detect, that is not sure actually, one can detect number of pregnancies in that animal, one thing. Then for this horn, again, in general, in some breeds, they are removing this horn after birth by cauterizing this horn bud area. Then still another, routinely amputation of horn, this type of operation is performed in case of field, and for this a nerve block is used, and site of that nerve block is actually, this is frontal crest. Lateral to this frontal crest in temporal fossa, there is a location of cornual nerve, 2.5 centimeters below the horn base, and along with this frontal crest in this temporal fossa introduce local anesthetic solution. It blocks cornual nerve and it is useful for operation purpose. It makes this area desensitized and use, this is called as actually cornual nerve block. This is one thing. Then this is forehead region, actually frontal bone area, and sometimes in this frontal bone there is a space that is called as sinus, and sinus in frontal bone, that is frontal sinus. In sometimes what happens, if fracture of horn is there and if that case is not treated in time, and due to secondary complication, what happens, there is a formation of pus, and that pus is gathered in that sinus. Sinus means space present inside the bone, and that space is actually frontal sinus. Whenever there is a pus in frontal sinus, a defining type of operation is performed. Make a hole of small caliber in the central part of this forehead and remove pus with the help of syringe. Nowadays this type of operation is not performed. This is all about horn, forehead. Then eyes, that is again mucous membrane of eye is the site for confirmation of whether animal is suffering with dehydration, congestion, etc. Then different types of anesthesias, local anesthesia or nerve blocks, these are used, that is retrobulbar. Retrobulbar nerve block is performed for extubation of eyeball. Whenever cancerous condition of eyeball is there, retrobulbar type of nerve block is used, and this external canthus, through this external canthus needle is inserted. And lastly, suturing, these leads, upper and lower eyelid, these are used for suturing. That is with the help of retrobulbar nerve block. Then this is ear. Now, as far as ear is concerned, ear is best site. Again, it is useful for tagging and tattooing. For putting these tattoo marks or tags as a mean of identification, generally this ear is used. And this external surface of ear is having ear vein. And this ear vein is generally used for giving intravenous injections in case of cattle. Then this is organ of hearing actually, but as far as still another, if a number of operative procedures these are performed, that is oral hematoma in case of dog, that is common condition. Whenever there is accumulation of fluid, hello, whether I am audible, hello, Patil, ऐकू येते का?
Yes sir, please continue.
आवाज केलेला आहे म्हणलं. ठीक आहे. Now oral hematoma is the condition, hot and painful condition in case of dog. In this condition, there is a accumulation of inflammatory fluid in between cartilage and skin of ear, and operative procedure, general anesthesia is given. Means again, this is having importance in relation with giving intravenous injections. Then as far as these operative procedures are concerned, tattooing, tagging, for all these things, this ear is used. Then still another structure, that is muscle. Again, this is very important. See, muscle is the black keratinized part present between two nostrils, and this is always moist, because on the surface of muscle there are rough lines which unites with each other, and they are forming rough irregular polygonal areas. And from the center of each polygonal area, there is an opening of nasolabial gland which opens up on the surface of the muscle, which keeps muscle moist. If muscle is not moist, that indicates animal is suffering from fever or hyperthermia or temperature, rising temperature. Then another important thing about this muscle, on the surface of muscle, as I have already mentioned, rough lines are there, and these rough lines, irregular lines, making uniting with each other and forming certain polygonal areas. These lines and polygonal areas, they varies from individual to individual. Hence, this may be used as a mean of identification by taking muscle printometry. Like in human beings, thumbprints are taken as a mean of identification. In animals, muscle prints, they are used as a mean of identification. Like tattooing and tagging, in case of ear, these muscle prints, they are also useful for identification of animal. This is another structure. Then still another, these are nostrils. See, nostrils, these are anterior openings of nasal cavity or respiratory system. Now, for observation of nasal cavity, a small instrument, that is rhinolaryngoscope, generally kept in this nostril, through which you will observe whatever is there any lesion, etc., or wound inside nasal cavity, that will be observed with the help of rhinolaryngoscope. This is one thing. Then another thing, simple thing, respiration count is performed by putting hand in front of nostril. Just put hand in front of nostril, you will count respiration rate. Then still another general type of anesthesia, particularly in case of these birds, these nostrils, these are used. Cotton swab sprinkled with chloroform is kept in front on this nostril. It produces general type of anesthesia in case of birds. Still another, these nose rings, these are applied in this area. Like these nostrils, these are again having applied importance. This is all about nostril. Then next, see, now these are again different parts. Now here, see, ligation of Stensen's duct. Again, routinely, parotid salivary gland is located below the base of ear here in this region, and its duct passes along with the posterior border of this vertical ramus of mandible, then dorsal border of this horizontal ramus of mandible, and it enters inside the mouth at the level of fifth cheek tooth. See, whenever there is a blockage of this Stensen's duct of parotid salivary gland, if this duct gets blocked, or if there is a damage or injury to the parotid salivary gland, then this saliva will ooze out. Then if such complications are there related with gland or duct, this duct gets ligated. This is routine operation, ligation of tension duct. Now see, this is the vertical ramus of mandible, and it is surrounded by masseter muscle. In front of this masseter or cranial border of masseter muscle is this, just above the dorsal border of horizontal ramus of 1 inch above the dorsal border of horizontal ramus of mandible, and in front of anterior border of masseter, we have to select this site for ligation of tension duct. This is still another applied importance. These are applied importances of different parts of head region. Then see, these are different muscles. This is masseter muscle actually. Now see, this is carotid salivary gland, and this is duct. This is masseter, this is anterior border of masseter, this is this mandible, and this is horizontal part of mandible, and here this duct is entering. Then again, these are different structures of head region. This is all about head. Now we will go for neck. Now, like head, neck is still another region which includes cervical vertebrae, different joints of cervical vertebrae, ligamentum nuchae, esophagus, trachea, larynx, jugular vein. Then different muscles, these are used for intramuscular injections. Routinely we are giving intramuscular injections in neck and CSF collection. Now here see. Now as far as neck region is concerned, we will study one by one. Now this is this neck region is formed by cervical. Vertebrae present in neck region, these are cervical. You are knowing. 7 cervical vertebrae, first is atlas, second axis, and third, fourth, fifth, sixth, and seventh. Now, in between atlas, first cervical vertebra, and occipital condyles of skull. Means the posterior aspect of skull, there is occipital bone, and there are 2 condyles surrounding foramen magnum. Through this foramen magnum, actually spinal cord passes behind, and it passes through neural canal of vertebral column. Now, in between occipital condyles of skull and anterior articular facet of atlas, there is a joint that is called as atlanto-occipital joint. This joint is also called as S joint. Whenever we are taking S, we are moving neck like this. This movement of 2 occipital condyles on the posterior aspect of this atlas in this fashion. And another joint, that is atlanto-axial joint between atlas and axis. On the axis is anteriorly, axis is having odontite process, a process projecting forward, which is rotating on the floor of neural ring of atlas in swinging fashion. And whenever you are telling no, this joint works. This is also called as no joint. These are 2 applied anatomical aspects of vertebral column. Again, different nerves, etc. They are entering, coming out through the intervertebral foramens located between cervical vertebrae. Then another important structure in this neck, that is ligamentum nuchae. See, this ligamentum nuchae, is there any diagram I am showing? Ligamentum nuchae is located on the dorsal aspect of neck. What is this ligamentum nuchae? Actually, this is a cervical part of supraspinous ligament. See, ligament, these are binding agents. No doubt in joints, for keeping that joint in position, ligaments are involved. In certain organs, bladder, different ligaments. For keeping that bladder in position, ligaments are involved. Like this, for keeping all these vertebral segments in position, various types of ligaments are involved. Now, from dorsal aspect, one ligament runs, which completely covers superior aspect of all vertebral bodies. Then from ventral side, inferior ligament. From dorsal side, from ventral side, that is called as infraspinous ligament. From dorsal side, it is called as supraspinous. Supra, infra, and then lateral ligament. Like this, all these ligaments are there. Among that, supraspinous ligament, which covers dorsal aspect of whole vertebral column, near about up to this thoracic lumbar sacral. Now this supraspinous ligament, it is having 2 parts. One part is actually cervical part, and another thoracolumbar part. Now this cervical part of ligamentum nuchae is cervical part of supraspinous ligament is actually ligamentum nuchae, and this ligamentum nuchae is formed by long elastic fibers, longest elastic fibers of the body with fat. Fat and elastic fibers combinedly, they are forming this ligamentum nuchae, and this powerful elastic apparatus is useful in case of bullocks for pulling this loaded bullock carts, etc., and in case of working these draft purpose stallions or draft breeds of stallions, they are in draft breeds of stallion also. This ligamentum nuchae is very well developed, and on this is in general. Now applied importance, what happens in case of bullocks, particularly this yoke. That wooden rod is kept on the dorsal surface of neck, and due to continuous irritation of that continuous working of that yoke on this ligamentum nuchae, there one inflammatory condition is formed that is called as yoke gall, and there is a formation of fibrous growth, and that will be removed with the help of operation. This is ligamentum nuchae, powerful elastic apparatus in cloven-footed animals, but still, when we are comparing this ligamentum nuchae as far as sheep and goats are concerned, just observe goats and sheep. Sheep, they are putting their head in downward fashion, while goats, they are putting their head in upward fashion. What is basic difference here? Ligamentum nuchae is better developed in goats and poorly developed in sheep. That's why they are putting their head in downward fashion. This is all about ligamentum nuchae. Another important step, as I have mentioned, this intramuscular injection. Intramuscular injections, they are given in neck. Generally, for intramuscular injections, bulky mass of muscle is required. Generally, site for intramuscular injection is in front of this shoulder, anterior border of shoulder, or 4 inches in front of shoulder and 4 inches below this ligament. This is the site for giving, this is the best site for giving intramuscular injections in cattle, because no doubt here trapezius, rhomboideus, various types of muscles are there. Muscular bulk or belly or this bulk of muscles, they are more here in this, and this is safe site for giving intramuscular injections. Then this is all about intramuscular injection. Then another structure that is here, this is actually jugular vein. Now this jugular vein, it is useful for giving intravenous. In the lower aspect of this neck region, you will find a with palpation, you will palpate. There is a procedure for palpation of this jugular vein. Now this vein is useful for giving intravenous injections in case of cattle. As ear vein is also another site for giving intravenous injections, but routinely we are using this jugular vein. Now this jugular vein is located in jugular furrow. Now this jugular furrow is formed by or bounded dorsally by brachiocephalicus and ventrally by sternomandibularis muscle. In between these two muscles, there is jugular furrow, which contains jugular vein, or in sequence, if you are observing structures from left side, the skin, fascia, then jugular vein, esophagus, and then vagosympathetic trunk. Like this in sequence, these structures, these are located. Now the jugular vein is the site for giving intravenous injections as well as for blood collection. Then another structure here, that is esophagus and trachea. These are again clearly palpable in neck region. Operation performed on esophagus is esophagatomy. Means whenever there is a blockage of esophagus, is routine operation in field condition. Routinely we are performing in clinics or our polyclinics of our college. Now in this, whenever this esophageal passage is blocked or choked, that condition is called like choke with the hard object, mango seed or onion, etc. Then there is a swelling, and simple operation is performed. On that swelling, we have to incision is given. Anesthesia as routinely local anesthesia we have to introduce. In case of large animals, generally local anesthesia is given. Then inside skin, directly this esophagus will be visible, and swell on that swelled part of esophagus, take incision, remove mango seed or hard object, suture esophagus, and lastly suture seed. Simple operation, that is esophagatomy. This is one thing. Again, generally this type of condition is offered towards left side, because as far as why left side, because if you are knowing anatomical course of esophagus, esophagus is located up to 3rd to 4th cervical vertebra dorsally, and afterwards it runs left lateral position and not right. That's why generally such type of conditions they are observed, or they are treated, or they are visible from left side only. This is all about esophagus. Then another important structure that is called as trachea. Now again, as far as trachea is concerned, this is also called as windpipe. Now one emergency operation is performed in case of trachea, that is called as tracheotomy. This atomy term, tracheotomy, rhuminotomy, esophagatomy, means opening cavity of that organ. In this tracheotomy operation, it is emergency operation whenever animal is suffering from this HS, hemorrhagic septicemia. HS is caused by Pasteurella multocilia. This is bacterial disease. Means definitely you will treat very easily. Now this in this condition, what happens? Whenever this HS disease is there, this prognosis is generally grave, and this very acute disease, very fast that animal shows symptoms, and again very fast animal collapses also. That's why generally whenever animal is producing a typical sound and there is a difficulty in respiration, that type of sound, and there is a swelling in throat region or as well as brisket region, at that time whenever you are observing such type of symptoms, directly emergency operation is performed, because animal actually dies in this by this disease due to respiratory failure. That's why by performing tracheotomy, we have to give respiratory oxygen or artificial respiration, and we have to introduce oxygen. This is emergency operation in which through tracheotomy we have to give artificial respiration. This is one thing. And during after giving this artificial respiration, actual treatment of ACEs we have to perform. And this, as this is bacterial disease, sulfa is the drug of choice. We have to introduce sulfa through intravenous route, and then animal will recover. But we have to be sure that before starting symptoms, we have to diagnose this condition. This emergency operation, that is tracheotomy, is performed on this trachea. This is all about tracheotomy. Then we see cervical vertebrae, joints, trachea. Now larynx. Then muscles we have finished, and CSF collection. Now larynx and CSF collection. Now larynx is the sound producing organ actually. Respiratory organ after pharynx, larynx connecting trachea. One condition in case of equines, that is roaring, R-O-A-R-I-N-G. The roaring, that is roaring is the actually sound produced by lions. Now if such type of sound is produced by equine, they are producing such type of sound, then that condition is called as roaring in horses. Now in this condition, what happens? Larynx, framework of larynx is formed by 4 cartilages: cricoid, thyroid, arytenoid, and epiglottis. Now cricoarytenoides muscle, if gets paralyzed, that what happens due to paralysis of cricoarytenoides muscle, this some portion of arytenoid cartilage hangs freely in the passage of air, and due to this, whenever there is inhalation of air, animal produces typical sound. That sound is similar with that of sound of lion. That's why this is called as roaring in equines, and it is corrected by removing this whatever portion of arytenoid cartilage comes in the passage of air. That portion we have to cut. This is routine or simple habit. You may call it as habit in horses or condition in horses. Then another important, that is CSF collection. Now cerebrospinal fluid, for diagnosis of nervous disorders, CSF is collected, and cerebrospinal fluid is present in subarachnoid space. Brain and spinal cord, they are covered by meninges. 3 types of meninges: outermost, dura mater, arachnoidea, and pia mater. In between pia mater and arachnoidea, there is a space, that is arachnoidal space. Now this potential space present between these two, which contains CSF. Now for collection of the CSF, 2 sites these are recommended. One, that is, this is cisterna magna. In between brain, on the surface of brain and covering meninges, in between brain and meninges, there are certain spaces. These are called as cisterns. And in these spaces, this fluid is generally accumulated. And this fluid afterwards, this cistern is actually cisterna magna. In this, actually this space is present between cerebellum and medulla oblongata. And here, whatever fluid is there, for collection of this cerebrospinal fluid, directly needle is inserted through this foramen magna site. Actually, what is this site? Actually, in between occipital condyle of skull and anterior aspect of atlas. Because on the dorsal surface, anterior side of atlas, there is a notch. Due to that notch and foramen magnum of occipital condyle, there is a space. And through that space, if and during this, we have to flex this head region first. Then you will get exposed area of this, completely exposed area. Then pierce needle in that area, foramen cisterna magna region. Then you will collect, clearly fluid will come out. This one side, and another side, that is actually lumbosacral puncture between last lumbar and first sacral vertebrae dorsally. Insert needle, you will, from that area also you will collect cerebrospinal fluid. These are applied anatomical aspects of neck region. See, head, neck, means for all these things, just I am telling here brief, means basic knowledge of anatomy is very essential whenever we are going in field, or whenever we are performing any type of operation, whenever you are giving injections for diagnosis, for pathologists, for all these things, basic knowledge of anatomy is very essential. Now, third region, that is thorax. Now, thorax, it includes following anatomical structures, that is whatever applied. Now time is okay, I will go fast. Now, thorax, auscultation of heart, auscultation of lung, thoracic vertebrae, ribs and sternum. Now see, thoracic cavity, again I will give you I will because anyhow we have to finish up within 10 to 15 minutes. Now, thoracic cavity, roof, thoracic vertebrae, ventrally sternum, laterally ribs, anteriorly thoracic inlet, posteriorly there is a diaphragm which is partition between thoracic and abdominal cavity. Now here 2 to 3 basic things. One, that is auscultation of heart. For auscultation of heart, we have to approach from left side, because heart is located towards left side of the chest cavity, between third to sixth rib. Here clearly see, this is first, second, third to sixth rib. Here heart is located. This is heart. Now, medial to the elbow joint, from third to sixth rib, if in this region, from left side, if you are putting your stethoscope, you will listen heart sound. This is auscultation of heart. For auscultation of lung, see, this is the major portion of the thoracic cavity is occupied by lung, and ventrally in between two lungs, there is a space that is called a mediastinal space where heart is located. This, for auscultation of lung, a triangle is made. That triangle is formed by dorsal border connecting this posterior angle of scapula up to this os coxae. Then anterior border is nothing but posterior border of scapula, and third border up to this olecranon process of ulna, and ventral border connecting olecranon process of ulna up to tuber coxae. In this triangle, if you are putting stethoscope, you will listen lung sounds. If lung sounds normal, just compare with normal lung sounds, and if they are having more or less, that may be that is concerned with, that indicates animal is having some respiratory problem. Then okay, this is all about auscultation, auscultation of lung and heart. Then next, that is thorax, auscultation, thoracic vertebrae, okay, ribs, sternum. These are bones forming boundaries of the thoracic cavity. Then next, abdominal cavity. Again, here it includes following different structures: paralumbar fossa or flank region, abdominal muscles, site for nerve blocks, subabdominal organs. Means you must have basic idea about abdominal organs. Generally, in case of abdomen or abdominal containing stomach, liver, spleen, kidneys, intestine, etc. Now here generally one basic site, that is flank region or paralumbar fossa. Just I will tell you in brief about difference between paralumbar fossa and flank. Paralumbar fossa is the actually triangular depression present below the lumbar transverse process or lumbar vertebrae, visible from left as well as right side. And flank region is the actually fleshy mass or soft tissue present on the lateral wall of abdomen. Means definitely soft tissue, because abdominal cavity is formed by last 2 to 3 ribs and abdominal muscles laterally. Means apart from last, means after last rib up to ilium, that part is having soft tissue, and that region is actually flank. Means paralumbar fossa is triangular depression, and whole lateral wall is actually flank region, which is having soft tissue or fleshy mass. Then paralumbar fossa, again different types of operations, rheumatology, laparotomy, cesarean, or operations related with intestine, etc. All these are performed. Again, paralumbar fossa, again one nerve block, paravertebral nerve block is used. Again, paravertebral nerve block, left side, right side. From whatever side is there, from that side you have to approach. Paralumbar, this paravertebral nerve block, it is given. Again, 3 injections we have to introduce between T13 thoracic vertebrae and L1 lumbar, first lumbar. See, directly I will show you on diagram. See, this is the paralumbar fossa. This is the T13, L1, L2, L3. These are 3 lumbar transfer processes. These are sites where we have to introduce local anesthetic solution, because from these three lumbar spinal nerves, they are coming out and they are supplying abdominal wall, lateral wall of abdomen, right or left. Then this nerve block is performed, and again another importance here, lumbar transfer processes are very large, long, because the importance of long lumbar transfer processes, that they are providing much area for accommodation of larger voluminous organs inside the abdomen. Due to long transfer processes, accommodative area for abdominal organs gets enlarged. That's why lumbar transfer process, these are very much larger. This is all about abdomen. Anything remain? Because I am going fast. Then different nerve locations. So organs, their location you must have knowledge. Lumbar vertebrae importance. This is all about lumbar. Then pelvis and tail directly for rectal examination. For temperature, whenever you are taking temperature from animal body, we are putting the stethoscope per rectally. Then per rectal examination for pregnancy diagnosis, for fecal matter collection, for parasitic examination. For all these things, this per rectal examination is performed. Temperature count, I already mentioned. Pulse count. On the ventral aspect of base of tail, there is a ventral coccygeal artery which is responsible for counting pulse rate. Then sites for intramuscular injection. Below this rump region, actually, rump region is the region from which actually tail originates or springs. Now, just below the dorsal aspect of this sacrum and origin of tail, that area is actually rump, and that area is used for giving intramuscular injection. Generally, this different types of muscles are there in that area, and that is used for giving intramuscular. Biceps femoris muscle is located in that region, upper part of biceps femoris muscle, that is used for giving intramuscular injections. Then sites for nerve blocks, okay, various nerve blocks, that is for ureterotomy operation, pubic nerve block is used. As far as tail is concerned, epidural nerve block is used for operations of tail, and various number of surgical operations. These are performed. That is for ureterotomy operation. Whenever there is a blockage, I will show you one diagram. See, this is urethra. This is penis. Actually, penile portion of urethra. Urethra is having 2 parts. Urethra is common passage for both urinary and male genital system or genital system. Now, pelvic part inside the pelvis and penile part outside the pelvic cavity runs along with the ventral aspect of abdomen, and this penile urethra is actually penis. And whenever there is a blockage of penis or gets blocked, this penile urethra or passage of this urethra gets blocked, ureterotomy operation is performed. Generally, blockage you will find in this region. Here there is a sigmoid fracture of this S-shaped curve of sigmoid fracture, which is located post-scrotally. That's why generally in this there are chances of formation of stone or calculus. That's why generally post-scrotal incision is given on the ventral aspect of this abdomen behind scrotum, because there is a location of the sigmoid fracture, and generally there are chances of obstruction. And for this pubic nerve block is used. For this again typical procedure is there. This istiorectal fossa is the site. Needle we have to introduce through istiorectal fossa, and pubic nerve is located medial aspect of the sacrosciatic ligament. Introduce there the local anesthetic solution. It blocks pubic nerve, which supplies to this penis. Then for judging, again these 3 things: milk vein, milk veil, and milk mirror. For judging animals, this is udder and this is milk vein. A zigzag vein on the ventral aspect of abdomen in front of udder. A zigzag vein present in front of udder on the basis of size of this vein, if on the basis of its thickness or prominence, one can, if it is very much larger in thickness, that indicates that animal is producing more milk. Then this vein, it enters inside the abdominal cavity, just it runs forward and just forward towards umbilicus, just near umbilicus it enters inside the body, and where it enters inside the body, it forms a depression that is called as milk veil. If circumference of this milk veil is larger, that animal produces more milk. And third thing, that is milk mirror. In between two hind limbs, from posterior side, observe udder. If area of that udder or triangular area is visible, if that triangular area is much more, as much more, that animal giving much more milk. Means by observing triangular area between two hind limbs from posterior side, that indicates if area is larger, that animal is giving more milk. These are three aspects related with judging. Then forelimb, again different bones, and we are again different types of conditions, fracture etc. we are treating. You must have basic knowledge of different types of bones in serial order, different joints. Then nerve blocks, radial nerve block, median ulnar nerve block, and then lymph nodes, particularly in front of the scapula, prescapular lymph node is there. It gets swollen in blood protozoan diseases, particularly in Theileria babesia, particularly in Theileriosis. There is 11 times larger, the lymph node becomes larger, there about 11 times. If such large lymph node is there, that indicates that the area drained by that lymph node is not fit for human consumption, and we have to go for this blood protozoan diseases, that Theileriosis treatment, and will be recovered. Then this is all about forelimb, nerve blocks, etc. for fracture, etc. Then hind limb, similarly, bones, joints, lymph nodes, prefemoral lymph node is there, and nerve blocks. Then is all about all these basic aspects. Thanks for listening. I am very much thankful, all of you.
Thank you, sir.
Hello. Any query? Any question?
Thank you, sir. Sir,
Thank you.
it was very nice and informative session. It reminds our first year classes. Thank you,
thank
sir.
you.
Now
Thank
I
you.
request all participants to ask question or queries if they have.